Good evening here in Delhi. Welcome everyone to the session on called No Room of One's Own, Redefining Work-Life Balance in the Age of Work from Home. Welcome everyone, and thanks especially to the panel participants. The panel participants are Professor Venu Govindaraju from the State University of University at Buffalo, State University of New York in the United States, Professor Klara Jelinkova from Rice University in the U.S., Professor Elizabeth Lobo from Methodist University in the United States, and Professor Osman from University of Witwatersrand in South Africa. Welcome all of you. It should be very interesting discussion. Of course, a very serious set of issues about the future of the functioning of academic institutions. I'm not going to make any remarks or comments. I will go right into questions. I don't know whether I'm audible. As I said, I'm going to introduce the first panelist or present a question. So I would ask, first of all, Professor Loboa, whether she can share with us her thoughts about how she perceives the challenges ahead communities in making our situation sustainable. That many higher education institutions would claim that their lives enough and their work-life balance was difficult even before 2020. How do you see the challenges ahead to university communities in making their conditions sustainable?
Thank you for the question, Dr. Leighton. Nice to meet everyone virtually. I'm Elizabeth Lobo. I'm the provost at SMU, and I've been in my role just for about a year. And it might be an odd person to start with, because I do want to say at SMU, we are in a very different model. So I can have and share some of what we've done, but we have been in person since fall of 2020, August of last year. So I'll talk a little bit about what our practices are, and in particular, in the context of the work from home format and how thinking about affecting efficiency and effectiveness of the academic community, but also then go to this question around impact on differential impact on our faculty. So when the pandemic really initiated for us here in March of 2020, when we really went into sort of that shutdown modality across a lot of higher education institutions across the United States, we had the work from home model, which was quite effective for our faculty and staff, particularly during these early stages of the pandemic. It really gave us time to understand best practices for navigating a new normal in response to COVID-19. But as I mentioned, by fall 2020, August of last year, most of our faculty and staff had returned to work, and we offered in-person instruction with extensive safety protocols in place. So what we did at SMU is we increased our outside air production in all our facilities to 50%. We implemented all 6 feet distancing. We had masks, and we also did alternating schedules. So our students came in every other day. We did the high flex modality of teaching. For many months, we have been offering vaccines on our campus to all our students, our employees, our faculty, our staff, and their dependents for 12 years old and up. We offer both Pfizer and Johnson & Johnson. And so for us, as of this coming fall, we will be fully in person, and we'll no longer be doing even the red-blue rotation, as we call it, the high flex modality. So the majority of our faculty, staff, and students are vaccinated. We continue to offer testing and vaccinations on campus. So it's a bit of a different scenario for us. What I would say is that when we did go into this fully remote modality, what we did to help our faculty and staff was offer extensive training and additional support personnel. So we offered well over 25 hours plus of online best practices and online pedagogy. And for our students, faculty, and staff, we also did quite a number of outdoor opportunities to have some community engagement in safe ways. So I'll pause there because I'm sure the situation and what we're doing is quite different than others. But what I will say is in our multiple surveys of faculty and students and staff, it's been very challenging, the isolation associated with the fully remote environment. And so it is a component of what we're doing to try and really bring people together safely. Thank you.
Thank you, Professor Loboa. Professor Jelinkova, would you like to respond to the same question? In other words, how do you see the challenges ahead to university communities in making our conditions sustainable, particularly the work-life balance with this, whether or not your institution is in distance mode or not, how you think the higher education community in general should be facing these kinds of challenges?
And I think that's an excellent question. And just as a way of background, Rice University, who is also in Texas as Southern Methodist University, we were in what we call dual delivery, and in that way, it actually allows you to do a little bit of an A/B comparison, right? Because you have some people who are remote and you have some people who are in person. The reason why we decided to continue to have some people in person, very similar to what Elizabeth mentioned, extensive testing, vaccination, ultimately when vaccines became available, was because we had students who were not, for whom learning from home was not as easy. And I'll give you just a few examples. Rice is a needs blind institution. So that means that if we have the Rice investment, so if you're admitted to Rice, whether or not you can afford to pay is irrelevant because we will bridge you, right? And we need to be cognizant of the fact that not everyone has the same means. And so even when we switched to online in the spring, we actually had to procure computers. We had to procure internet connections. We ended up getting satellite connections for some of our students that are located in distant areas. And I don't mean internationally only, but we had students in areas of Texas that don't have good enough coverage, and we need to really figure out how are they going to be able to participate fully in online learning. And so ultimately, bringing those students to campus was important. Also, bringing students who at home may not have the best learning environment. Maybe they don't have their own bedroom in which they can study. It was very important to do that and provide support. Or some students who needed more mental health services and emotional support or support of a group. It was just very important to provide that. We did provide these, as I said, from a technology perspective, we bridged the technology, but some of these other elements became very important because you had students who did not feel comfortable turning their camera on, for example, when they were taking classes from home. So I think we need to be really cognizant of the fact, as Elizabeth said, that the online learning mode is very successful. And there's actually excellent study by McKinsey in K through 12 showing that middle class and above students perform better than students from low socioeconomic backgrounds. And we just need to be cognizant of the fact that it's not one size fits all, right? Now you ask, how can we make it sustainable? And obviously we, as much as we wish, we cannot resolve some of these larger socioeconomical issues. And so when we are thinking about universities, I think we will remain in person, especially in the undergraduate level, is for the 18 to 22 set. Because what we provide is not just education, and I'm sure that my colleagues would agree, because what we provide for our students is the opportunity to live away from home for the first time, to have leadership opportunities, have opportunities to be with different people that they would not have potentially ever met, international students that they would not have met if they just remained in their locale. And so I think when we are thinking about how do we make what we have experienced more sustainable, I believe that we should take what we have learned, but we should also take what was best in the model that we were in before and kind of blend it into a combination that would allow us to address some of these issues that I just mentioned, but also support student mobility, right? And so have these online elements for students who, for example, become ill or want to spend semester abroad and we don't have an agreement in the country where they want to go. So I think when we consider sustainability of this model, it is really the blending of what we had prior to March 2020 and what we learned into something that would create a supportive learning environment for all students, regardless of where they are or what their economic status is, etc. So let me just pause there and allow perhaps other panelists to respond.
Yes, thank you, Professor Jelinkova. Professor Osman, would you like to respond to that very general question about how you see, how you actually envision the challenges facing university committees about university communities making this kind of response sustainable? Is it sustainable in the long run, and what sorts of things need to be done?
Yeah, thank you very much, and thanks to my fellow panelists. I'm enjoying being on this panel already. So just listening to Elizabeth and Klara, I can see very clearly that we have very, very similar experiences. I have to point out that Wits University is one of the top universities on the continent and in the top 200 in the world. So in some ways, the experience that I'm going to talk about is not similar across the whole sector in South Africa. And I think we all have to be mindful about that. So what I speak about and reflect on here would not necessarily be the experience of another university in South Africa. We have about 23 universities here, and I think of the 23, 15 of those would sort of identify with the kind of experience I'm going to talk about, and the experiences are very similar to Elizabeth and Klara, with the exception of easy availability of vaccines. We haven't had the kind of availability of vaccine, Elizabeth, for our students in the same way you speak about. In fact, the vaccine rollout has just started a few months ago, and I myself have just received my first jab of Pfizer. So you can see that there's a world of difference. And I'm sure it's very similar in India as well. Having said that, I think that the blend, it's going to be very important that the blend doesn't end up, Klara, being a mishmash of sorts, but a careful thinking about what is it that we've learned and how is it that we can take what we've learned in a way that benefits all of our students and our staff members. In our university, we managed to take the top of the that graduates from the final year schooling group. So in other words, we really take the top of the range, but in taking the top of the range students, we've got to be quite inclusive. So 70% of our students are actually African students who are funded by the state. Now, this already tells you that if we're in a full online mode, which we have been, we're going to take into account the differences in the socioeconomic status of students. And so we've had to make residences available for students who work from home for a variety of reasons. Maybe the conditions at home are not amenable to studying further. There's also the issue around gender-based harm at home. There's also the issue of poverty and inequality. And so we've had to take all of that into account, and we allowed 5,000 of our 35,000 students to come back into residence, even though we were in full lockdown. So the net effect was they've been doing their work online from a residence room where the internet connection is good, where there's regular availability of food, good facilities in terms of internet, etc., etc. But 5,000 of those students have been on campus. And Elizabeth, like yourself, we've had to have a rotation of plans. So in other words, we could only use residences with single occupancy and where bathroom facilities available for individuals so that there was no communal use, etc. So overall, a direct answer to your question, I have to say I problematize this idea about work-life balance. And I think actually it's a fallacy or a fiction we tell ourselves. And mostly it's a fiction we tell ourselves because the balance can't really be attained. And so all of us search for this potion of balance when in fact there isn't such a thing as a balance. I much like to think of it as a continuum in a non-linear way where institutions have to keep their eye much more on the well-being of students and the well-being of staff. So I would much rather focus on well-being instead of focusing on balance, because balance actually is an elusive thing. You can't find it no matter how hard you try. And a direct answer to your question about sustainability is we're thinking very much about how we do synchronous and asynchronous teaching. And I have to say students have enjoyed the asynchronous because they're able to go to a lecture, rewind when they don't understand, pause if they need to go to the bathroom, come back, etc. We're thinking very much about a good part of our program being available online, but a very good part of it being available in the in-person mode. And the in-person mode is really motivated by the fact that much of the learning that students have comes from outside the classroom and not inside the classroom. So the networks that they will build in the canteen, in the residence, etc., will happen outside of the classroom, but on the university campus. Thanks for that question.
Thank you, Professor Osman. Professor Govindaraju, if you'd like to tell us about your impressions about how the measures that your institution has taken to deal with this particular crisis, whether what you think has worked and what hasn't, what you think should be done to make the situation sustainable.
Okay, thank you, and good day to everyone, depending on where you are on the globe right now. First of all, very briefly, so I am a Vice President for Research and Economic Development at the University at Buffalo, State University of New York. State University of New York system is one of the largest university systems in the world. We have 64 campuses and more than 100,000 students in the system, and UB is the most comprehensive campus in the system. Let me try to give you a slightly different perspective. I agree with all my distinguished panelists over here, and they have made very good points. And I was just taking down some notes, trying to say a few things which perhaps have not been covered so far. So I heard Klara talk about how learning of students and the first time experience of coming on campus is vital. I think we should also not forget that remote learning and individual student learning is not suitable for all students. Some students can do self-study and stay alone and listen to lectures and understand the material. But by and large, it has been shown that we learn better in groups. So a student learns when another student asks a question and it gets answered. The same student may not have asked the question, but just in group by the interactions, there is a lot of learning to be done, and that cannot be, so there is no substitute for that. I also, want to bring in the perspective of research and research labs. We are a comprehensive research university with more than $430 million of research every year. And some of the things that we found were, when it came to research, while everybody, maintaining all the precautionary measures of 6 feet distancing and masks and schedules and so on, we were effective. But it was disruptive, right? I mean, the schedules had to be maintained at odd hours in the evening, just so that everybody gets access. And while we allowed remote working, there was also some difficulty in actually coming to the lab and doing research. And if your research involves human subjects, right? So in several clinical trials research, how do you manage those? Because you actually have to have human subject interactions. But one very interesting aspect that has surfaced itself is now that the pandemic maybe, hopefully, is subsiding and will return to normal in this fall, is that several people have now realized that they can be quite effective working from home. And there are staff on university campus, and this perhaps holds not just for universities and the academia, but for all industries, is that if you're effective working from home, then should you be allowed to just stay home and do your work? And then what happens to us all coming together, on campus? So we have had, so when we talk about work and life balancing, of course, it's much more convenient when somebody is home, they can take care of the kids. The kids are being dropped off by the school bus. They are there on time, babysitting, and, all kinds of other chores that were part of some kind of a structure before have been disrupted. And while our staff have made adjustments, they have realized that staying at home and working is actually a convenience they don't want to give up. So we have this issue on campus where people are saying, great, we are vaccinated and everything is back on campus, but thank you, we'll still continue to work from home. And that may be okay for those staff who are not student facing, who are not faculty facing, who are anyway working in the back offices. But when we want students back on campus, it would not be fair to say the faculty and staff shouldn't be back on campus. So we're dealing with some of these kinds of issues. Another very interesting observation, and thank you for my distinguished panel, mostly other than the moderator and myself, women. And there has been a lot of discussion about gender parity and how this pandemic has affected our women faculty on campus when it comes to research productivity, right? So, there are certain things which people have realized now that women actually take more of their fair share of load at home. And so when everything is at home, they are probably not getting the same advantage that men are getting, with the no commute and all the other conveniences. So when we looked at this data, and this data holds, by the way, across universities in the US, that research productivity for all faculty has gone up in this pandemic year. People have found time to write more proposals, to write more papers, do everything more. But the increase has been significantly higher for the men faculty when compared to the women faculty. So there are these parity issues that we want to address. Talking about mental health, even before the pandemic, our students were actually having issues of mental health, right? And as most students, in that age group who have been slammed by all this social media and then all these different websites and social activity, and all kinds of issues have emerged, not just because of that, but mental health has been something that has to be addressed, and that has gotten aggravated during these pandemic times. So something to be looked out to. And one last comment I would make before I turn over the floor back to you, is that when I talked about working from home, and I mentioned that some people want to continue working from home, and this has to be also looked at from the market forces viewpoint. So I'll give you an example. For example, the IT people, who can work on a computer, they don't need to go to a lab and pour chemicals or do certain things in a lab. They can actually work remotely and do everything that they can. They are being poached by other universities and other companies who are offering full 24/7, 365 work from home. And now we suddenly have to compete with them because they're getting poached. So there is a new dynamics that has set in, not just in universities, but also I was in Silicon Valley a few weeks back, and they're having the same issue. People are reporting back saying, well, my company is in California, but I like to live in Florida and I'm going to do things remotely and so on. So there's going to be a churn. We still don't know how this is all going to pan out. But I think we have to wait and see, what happens. So with that, let me turn it back to you, Dennis.
Thank you, Professor Govindaraju. And that several of the things that you have all said, I think helps us segue into another question. And I'd like to turn this over to Professor Osman, because she had brought up this issue in using particular terms. Professor Osman had suggested that the idea of a work-life balance is perhaps illusory, and that we should think in terms of a continuum and so on. And several of you have also said something about that. So given that, as Professor Govindaraju was already pointing out, there are already indications of, groups or constituencies who seem to be gaining more from this work at home situation than others within the university context. Obviously, others are suffering more than others also, and it may not be so easy to, kind of classify them into groups. But given that many studies around the world have already highlighted the fact that some people seem to be more vulnerable to the challenges of work at home than others. Professor Osman, in particular, any ideas about that? And I'm turning this over to you because you were the first of the panelists to suggest that there's perhaps something wrong with the very term work-life balance.
Yeah, thanks, Dennis, for picking that up. So I think we've already spoken briefly about actually how women academics are vulnerable now and going forward because of the expectations in terms of what was able to be produced by colleagues in terms of research output. So I think we've covered that. But a group of people that I think are particularly vulnerable are emerging academics. And those are the academics who need the opportunity to be in the university in a face-to-face or in person to be able to benefit from the intellectual life that a university bricks and mortar offers. And I think they stand, in my view, to be the most vulnerable currently, because their access to mentors, access to opportunities with more senior staff, access just to the opportunities of engaging in an intellectual community and the intellectual life of the university will impact, I think, quite seriously on emerging academics. The other vulnerable group, in my view, would be those students who are in their postgraduate studies and who are thinking about academia as a career choice. I think that the opportunities and the examples being set for them will be few and far between. If, as Venu suggests, many people would want to stay at home and work from home. So I think we're going to have to keep a particular close eye on the well-being of emerging academics and emerging women academics, and in my context, women of color, and then young postgraduate students who are having to decide, is academia a career choice for me, or should I just think about something else? And I think this is where Klara's point about the fact that we're always going to have the online, but we're always going to have a physical university where people go to and come to, going to be very important. And I think that our HR departments are going to have to do quite a lot of work in terms of governance and regulations. So Venu has already talked about IT poaching. We experiencing it firsthand. Someone in our IT department has come with an offer, which is not double what he earns, but triple what he earns from an organization just around the corner from the university. And so that IT poaching has happened. But what we're going to have to do with HR is, I think we're going to have to think about rules around what constitutes being present in the university and who gets to exercise particular rights. I'm afraid to say, I think senior male professors will benefit the most from the experience of working from home and actually producing the most research And the fact that it will be this cohort of people who benefit will be overlooked because the returns to the university will be great in terms of research output. So as a provost at my university, I'm keeping a very close eye on what HR needs to do to rethink how being present at a university is now thought about, and how we think about it, and for whom it applies, and how it applies. And the most important principle there is going to have to be the principle of fairness and transparency.
Thank you, Professor Osman. Would Elizabeth Lobo like to chime in here, particularly about, you'd mentioned about ways in which your university had responded to the challenge beginning in March of 2020, and the fact that you were able to sustain, largely sustain an on-campus mode of learning and research and so on from the fall of 2020. But given some of the things that have been said by the panelists about, kind of differential gains and disadvantages posed by the work at home situation. Are there ways in which your institution has been, kind of thinking about these issues or thinking about ways of addressing imbalances?
Absolutely. No, and I'll speak personally too, to agree with Dr. Osman in the context of this work-life balance. I obviously administrator, have a very busy position, but I'm also married with 5 children. So when I look at work-life balance, it's not this, it's this, right? So sometimes life calls and I've got a sick child, we've got things we've got to do, and my husband and I got to coordinate that. And then other times, I'll speak with the faculty member hat on, that big grant was due and I've got to focus on that. And so I never see it like this. I've always seen this continuum, as was discussed. Now, from the context of differential impacts, I'd say on women, men, on underrepresented minorities, absolutely, we are also paying very close attention to that. Now, I would say from the context of thinking about this as higher education in general, we are very different across the states on what has opened up where and when. So in the state of Texas, which was one of the first to really open up, what that also meant is that daycares and facilities and opportunities that allowed women and men to come back to work, and some of their support networks were in place earlier here. Now, in many places across the country and of course across the globe, when you're in these lockdown modalities, you don't have that. And so you really do see these differential impacts on our women and our in different constituencies. So we do pay very close attention. We are working with multiple of our groups across campus. So we have a Black Unity Forum, we have an AAPI, Asian American Pacific Islander, we have the President's Commission on the Status of Women, who as an administration, we work very closely with to talk about and then think about how we address differential impacts, not just in the current pandemic modality, but also just in general. So if you look at some of the literature that's come out, say from ACE, for example, it shows how there are additional, say, mentoring and advising that, say, our faculty of color are doing informally pre-pandemic, just in general, because faculty or students who are underrepresented will want to go to our underrepresented faculty to feel to talk to individuals. When I was a faculty member, being a woman in engineering, I noticed informally I would have a lot of women wanting to come to me. My lab would be a lot of women, and I would also just be doing a lot of informal advising and mentoring that just happens as a part of being a smaller population. So a lot of what we're looking at and what I'm doing in my role as provost is consistent with what Dr. Osman just mentioned. How can we look at transparency and equity? And we're establishing all the way down to the department level clear and transparent workload policies, where we even ask that they provide a service matrix that also helps to capture some of this informal additional work that's occurring. that we can then give credit for and make sure that we're giving everybody an equal opportunity to succeed. And I would say that's not just a component during the pandemic, but frankly, what we need to think about just as institutions of higher education in general. How are we doing everything we possibly can to make sure that we give every single person equal opportunities to succeed? I want to say, I think higher education is a wonderful field. I don't want our junior faculty coming in to say, oh my gosh, because they're looking at the pandemic, that this is what it's like. There's no way I can do this balance. I would say as administrators, even when we were 100% online and those lines really blur about when am I working, when am I able to focus on my family, and that blurs when you're working from home. We can help establish, I might send out emails at night or weekends or when my kids are saying, okay, I want to go do my thing, Mom, don't make me hang out with you. I've got teenagers and college students now. So they're saying, yeah, Mom, I don't want as much attention now. I want to hang out with my friends. But I would say to my team members who have younger children, this is an FYI only. No response needed. We can work on this on Monday, and try and establish those parameters so we can help our faculty and staff understand that they can have that balance, and that we're not, just because we're contacting them, they don't have to answer on the nights and weekends, even if those are times that we might be on. I'm originally from Northern California. I was from Silicon Valley. So just in the mentality there, just sort of my whole growing up, I'm more outcomes focused. When people do what they need to do, if it's not in the exact normal time period of an 8 to 5, I don't care. As long as we're all getting our outcomes and that we're facilitating the success of everyone that's here. But again, I say that almost, from a point of, we're very fortunate here. I mean, we have a daycare center on campus for our faculty and staff. We have vaccines on campus for our faculty, staff, and students. So there are differential challenges depending on where you are. So we're very fortunate here, and I recognize that.
Dr. Dennis, if I may we also
Yes.
happen to have Dr. Vidya with us, and I think it would be lovely to hear her perspective as well. So she's in the room.
Yes, I'm sorry, I didn't realize you was here. Please jump in. I was going to ask the next question of Professor Jelinkova, but yes, let's have an intervention from Dr. Vidya also. Please,
Yes.
Dr. Vidya.
Thank you, Dennis. I thought you would see the screen and you would see me, but
Yes, I do see you now. Thank you.
Yeah, I've been here since 8 p.m. Nevertheless, I think the situation is pretty similar here in India, because I see my colleagues from places outside of India. I think we went into a lockdown in March of 2020, and it was a more of a reactive response by faculty members as well as students. Students just could not take it because they had to be just packed home over the night, and we were worried about the safety of students then. And for faculty, it was very difficult to suddenly switch over from a face-to-face mode of teaching to online teaching. And but they did manage it beautifully. I think all faculty members of all Indian universities, irrespective of where they were, tried to do their best to engage with students. And it was typically exam times in India. March and April are exam seasons in India, and it was very difficult to carry out assessments and evaluations online, but they did a wonderful job. But fortunately, India went into a huge total lockdown in the next 2 months. And that gave all the universities and colleges in India enough time to train their teachers. And the training levels varied from someone who never used, technology in colleges that are in remote places in India to, places like Symbiosis International University that I represent here in the city of Pune, or OP Jindal, and several others who had faculty members who were used to using technology. Again, the diversity of students in India, like the Symbiosis International University, one of the largest universities that I represent, has more than 40,000 students from all states of India, coming from, urban cities, rural areas. And the challenge was again to, get them on board, especially for the online lectures, even after the next academic session started. More importantly, to engage the non-teaching staff to be working from home, and again, issues of bandwidth and other challenges. And I think some of my colleagues did mention about the gender issues, and I have a little different opinion, Professor Govindaraju. Women staff initially enjoyed the work from home because they were closer to kids. Kids also didn't have schools, closer to other family members. But now we realize that many of them wanted to come to work because, there were more, families were more demanding when women work from home. So while you're sitting in front of a screen, someone would just tell you to make tea for them, or, children would come and bother them. And therefore, the kind of respect that they would otherwise get to, leave home and come to work, many of them felt they didn't. And we did a little survey within our university, and wonderful findings that came out showed that women would prefer coming to work than really work from home. So that was a very stark difference from what we, from the management, felt. The second, of course, was, the mental health, and some of you have covered it. And I think this was one big issue that most of us have faced, specifically mental health issues among students. And for us, of course, we have a dedicated Symbiosis Center for Emotional Well-being. We had counselors on campus, but surprisingly, the number of students that sought online counseling was huge, much more than what it was when students were on campus. And I think that was a very, again, some finding that was pretty surprising. I think it mattered to students to mix up with their own peers, come on the university campus and enjoy the campus life, then really just the teaching part of, what we all are discussing. So while online education, did deliver what we wanted to, of course, we're still not sure about the learning outcomes of students as what they would have had during a face-to-face conversation with students on campus. But I think it was more important about the kind of environment or kind of things that they learned beyond classrooms that obviously all of us emphasize more upon, learning from peers, learning from, community. The other was, of course, the challenges that we faced were typically skill-based programs and laboratory work. I think my colleagues, some of them did mention, I think Dr. Govindaraju, you mentioned that you still opened up labs with people in masks and maintaining social distances. But in India, it was very, very strict. You still cannot open up labs and you cannot open your campuses. So it's very difficult to, for the skill-based programs like the School of Photography that we have, or the School of Culinary Arts, or the biotechnology, it's been very, very difficult. And especially students who are in the 2 years program, the whole of last year, they've not been on campus. And the second year, again, it's the same. So what we've done is we've extended the year for another 6 months for students. Even if they're placed, they could come back and make use of the labs at any time. Now, of course, the vaccination, many of the youngsters in India have got the first jab, not the second one. But yes, with the testing facilities on the hospital, we have a hospital on the university campus, and with one jab, we're at least expecting students to come into the laboratories and do their work. But for others, for the humanities, social sciences, typically the management and law students, the problem was about placements. So while they did get job offers in March, because we have excellent placements in the last March, but companies did not want to join them, obviously, because most of them were closed, shut down, or many of them converted these placements into virtual placements again. So while students were excited to go on, on the campus of companies for their new jobs, it was very disheartening to get those virtual jobs or research-oriented jobs, and that was again a big challenge. As regards work-life balance, I think it's very critical to engage with the women staff specifically to provide them with more facilities. And again, I heard about a daycare center, and that's exactly what we have. Fortunately, we also run K-12 schools, and therefore we had a daycare center of one of our schools that we opened up for all our staff members, and I think that was a big boon for them. That's what we've done. And again, opening up hostels for students who came for laboratory work just very recently after their first jab is again something that we've done. So I'll stop here, Dennis, and maybe I'll go ahead with some other questions.
Yes, thank you, Dr. Vidya Yeravdekar. Thank you for those comments. I'd like to again return to Professor Jelinkova about this issue again. Again, the topic or the theme of this session is work-life balance, which may in fact be an illusion from various perspectives. Again, is there anything you can share with us about your institution's response, ways of intervening, or kinds of adjustments that have been made by the institution to deal with these work-life balance issues?
I think had a comprehensive discussion about this, and I think it has been covered exceedingly well. I think one of the just two quick comments so we can proceed to additional questions possibly is when we are thinking about work-life balance, this being cognizant how different people respond, and the fact that we needed to have more inquiry, right? More surveys, more town halls, more communication. So in some ways, when we were in person, we would always rely on the water cooler talk, sorry for the Americanism, but we didn't have that, right? And so kind of getting more of a sense of how people are doing, right? And so I think that is, something that I believe we have done very well. We surveyed people quite extensively, not just faculty, staff, and students as different groups, students as graduate and undergraduate as well, because obviously facing slightly different issues for the exact reasons that everybody else has mentioned. I think the other element is really embracing mental health as a challenge that we need to respond exceedingly well to and have supports available for all of our constituents. Again, it has been mentioned before, and I don't want to belabor the point, but I think those are the things that we need to think about. And also, let me just say one more thing. When we get on a Zoom call, how often do you get the little chat, right? The kind of, how are you doing? How is your family? Oftentimes people just linger a little bit after a meeting and just kind of catch up with each other. And it's this warmth of our social connection. And I think and it pains me to say it because technology is my field. One of the things that I believe we have been robbed of is this element of civility, element of joy, element of celebration, being together, holiday parties, for example, right? And I think we really need to consider that this is very important for us to address, because you cannot have people just kind of go through day after day that appears to be the same in front of a Zoom screen without having celebration with others, without congratulating others, without, having joy in their lives. And I think if there's something that I hope we really work hard to bring back, it is that communal experience of us as people. So let me just stop there, because I know we are running out of time, and my esteemed panelists, I'm sure, have comments that they would like to share.
Thank you very much. Yes, we don't have very much more time available, but given that all of you occupy rather different locations within your institutions, you're all administrators one way or another, but you play different roles, research, management, research, and that sort of thing, Provost. This time now for some, final observations, I guess, about how things look from your perspective. I've been asking you questions that have largely to do with what you think your institution is doing, or what has your institution done. Given your particular positions in your institutions, it would be interesting to hear from Professor Loboa first, and Professor Govindaraju and Professor Osman as our final comments for this session. Thank you. So Professor Loboa first.
Thank you. Well, I think I've touched on quite a bit of it. Our planning is as I mentioned, and for a lot of the reasons that have been so beautifully elucidated by the other panelists in the context of how do we really deliver not just an exceptional educational opportunity for our students, but also really around these surveys for mental health and and how our students, faculty, and staff really want to come together. And so as I said, we will be fully in person. We have done extensive planning to be able to do that. We have already been in person throughout the summer with our, we've had summer courses, May, June, and July. And of course, we were in the hybrid modality last year. This year, we will not do the hybrid modality with remote learning unless it's just specific graduate courses and the like. But for our undergrads, we heard loud and clear their immense desire to be back together. But we are in a very, as I said, different situation, and incredibly fortunate with the availability of vaccines and also support infrastructure and networks. So we're planning for an exceptional fall and spring, and I think some of the things that we've really learned as far as what we can take from this approaches, in particular with remote learning and those opportunities, is that it does allow us to even further some of the pedagogy. An example was given around asynchronous and allowing some of our students to go back and listen to lectures over again, even if they were there in person, and different understanding around availability of technology. I think we've also learned a lot about our students and where they come from, and what we can do on a much more personal basis to not only just think about offering them the very best education that they can get, but also around really thinking about them holistically and as a whole person. And while it had been mentioned already, I think mental health was already obviously a concern pre-pandemic. It has really escalated in the pandemic. And because of all the surveys and the very engaged time and interactions we've had with our students, faculty, and staff, we've learned a lot more about what we can do. And I'll refer to Klara's comment at what we can do for community and bringing more people together in safe ways, because the isolation is real and has had a very negative impact. And we are looking and planning on what we can do to have more celebrations and joyful times together above and beyond just the great education that we want to provide. So thank you for the opportunity to provide those closing comments and to be on this wonderful panel.
Thank you. Thank you very much. Professor Govindaraju, we have a couple more minutes left. If you have any final observations,
yes,
discuss in this session.
Let me make a quick observation that, too much of a good thing is also not good sometimes. So the convenience of scheduling these meetings, this panel, international panel coming together with this technology of Zoom. Well, the downside of these Zoom meetings is they're always scheduled back to back to back to back with no breathing room. So I have a meeting, coming up right, at 11:30. And, previously we used to get time between meetings. I would walk to a different room, different building, chat with colleagues, and there'll be an unwinding and focusing. But now it is, Zoom after Zoom, and that can be quite, the fatigue sets in quite easily. My closing remarks on this is just one statement that this pandemic has thrown a curveball at us on every corner. We really don't know what's in store. The other day I saw news that Los Angeles has gone back to the masks because of this Delta variant, and nobody really knows how these things are going to unfold. Things are definitely changing, and we'll see how it unfolds. So thank you to all my distinguished panel colleagues over here. It was wonderful, sharing these thoughts and this conversation. And please excuse me if I sign off at this minute. I have to join.
Yes, and on that, thank you. And on that note, we do have to move on to the next session. So I thank the panelists for their interesting, valuable contributions.
We have another 10 minutes. Perhaps we can use another 10 minutes, and we can have
another 10 minutes.
Yes, we do have.
How did we get an additional 10 minutes? Well, thank you, Anamika. I wasn't aware of that. Okay, well, we could leave more time for final comments. And in fact, I think we'll close the session that way rather than my introducing the question. There's been a certain amount of overlap in the answers that have been given anyway, and I think that's been just fine. Professor Osman perhaps would like to give a couple of observations about the challenge. Again, the person who I think fundamentally questioned this notion of work-life balance, I think deserves to say something about how we redefine work and the sorts of life that we lead in universities these days, given challenges, not only this particular challenge, the pandemic, but challenges are also going to be in other areas, right? If you're in California or Wyoming and you're fires and there's so much smoke, that is dangerous for people to come in. I mean, this is, and perhaps not to trivialize these things, this is actually a relatively minor crisis compared to those faced by people in many other countries. So while of course we would all hope that we have this particular health pandemic situation solved, it's very likely, according to many experts, that the university as an institution will continue to face crises of similar scales and impact. So, regardless of what particular method we come up with for the moment of allowing us to work from home or work in situ or whatever, we will continue to face challenges of these sorts. So again, hand it over to Professor Osman for final comments.
Thanks, Dennis, for that. So I think we've taken a lot of time. Everyone talks about working in safe modes and working safely together and bringing us safely to and so on. But I do think there are two elements I'd like to comment on, and that is that as we come together, community again, it's going to be a community that has suffered enormous grief and loss. And for that, we're going to have to think very seriously about allowing for periods of uncertainty and for periods of constant readjustment, especially for those who've experienced the kind of loss I speak about. So I think when we come back together as a community, I'd like us to remember that we're coming back as a community that has suffered. And because of that, we need to allow for elements of uncertainty. But importantly, I would like to, certainly I'm thinking about it as Provost, is to find ways to sustain an institutional culture that enables each of us to be able to bring our whole selves to work. And I think if we can sustain that kind of culture, the risks around technology, the risk around disease, the risk around loss will be ameliorated, because work will become that place where I can bring my whole. So I think going forward, we're going to have to allow for uncertainty. We're going to have to allow for readjustment, but we're going to have to work towards the institutional culture that I speak about. Thank you very much for being on this panel. I've enjoyed it very much, Dennis.
Thank you all panelists. Again, I had already given closing thanks, but I think
allow me to just step in and thank you for hosting the session, obviously by our esteemed Indian colleagues for all the support that we have gotten. And again, thanks to my wonderful panelists. It has been a delight to be on this panel. And with that, I would like to hand it over to Dr. Yeravdekar, if she wants to say a closing comment, perhaps.
Thank you, Klara. And it's been a very interesting panel. And I think all of us as women specifically here, there are more women than men on this panel. I think there's a lot to learn because we've experienced something that we can actually implement in our universities. And I think it's all about introspection. This whole period has been a whole period of introspection, a lot of spirituality. And I think it's also been a lesson to be sensitive to others' needs. And I think the young children, especially who were not as sensitive as what we wanted them to be, I'm sure they have become. So when we're all back on campus, yes, Klara and Elizabeth, as you all said, it should be a period of celebration. But then I think, as Ruksana said, it is also about, giving that flexibility, giving that little adjustments, and also being sensitive to people who've gone through grief, and be happy and that you are fortunate that you didn't go through that grief. And I think it's been a huge change for each one of us and for our young students and faculty members. And I think to keep this whole the whole campus again bring in that vibrancy, it's definitely is going to take more time. But yes, we are waiting for students to come in. And I like always say that, university campuses are like gardens without flowers. And I think we're just waiting for those flowers to bloom. Thank you.
So beautifully said. So if maybe Dennis is back, maybe Dennis can close us off.
Absolutely.
Yes, I am back. Perhaps Anamika would like something to say since she has intervened. Anamika?
This is a panel. I mean, there are distinguished speakers here, and I don't want to barge in like, uninvited guest. But yes, it's a very relevant topic. We all have been going through living this firsthand. And I think working from home, I cannot agree more with the fact that, sometimes we do want to go back to our offices. We want to sort of like, work, from our campus. There have been an element of, belongingness when you're sitting on your office desk, and that actually brings in the idea that we are not simply, I mean, you cannot bring in all the material in the house and then call it your office, workspace and start delivering. It doesn't work like that. It has to be organic. It has to be, and therefore it actually sort of tells you the importance of your workspace, of your colleagues, of that community, of that sort of an environment that we have in a university space that cannot be replicated, just because I have like, some of those material at my house at the moment. So I think that's where I would like to stop. And thank you very much. It has been very, very delightful discussion today and a very relevant one. Thank you.
Thank you all. Yes.